Mesolipolysis, lipolytic solution of fat dissolving solution or fat dissolving enzymes. What exactly is this? Basically, lipolysis contains various enzymes, the most popular being deoxycholate, sometimes PPC, lipase, etc. enzymes, carnitine, L-carnitine, which were used earlier, phospholipases too. Now, today we only use deoxycholate. So, what exactly are these? So, this basically is when injected into the fat cell, it is taken up by the fat cells, it destroys the membrane of the fat cells. Once the fat cell membranes are destroyed, then our body's immunity will act against the fat cell and which will destroy the fat cell and take it away. Okay? So, these fat cells are basically go through the lymphatic system. They are drained off by the lymphatic system and they are absorbed and thrown out of the body. So this is why lipolytic solutions, especially deoxycholate, can cause reduction in the fat in the local areas. Where can this be used? In the double chin area, around the jaw, in the lower face, in the stomach area, flanks, arms, a bit in the inner thigh or outer thigh, back, maybe a little bit on the chest, especially male chest, and various other areas. Now, typically, the amount of solution which is required for this to occur is in the face around 2 to 5 ml per session. In the body, you can use up to 30 to 35 ml per session. Now, where is this solution exactly injected? So, we take this solution, mix it with a little bit of local anesthesia in order to reduce pain. And then we pinch up the skin and we inject it into the superficial fat layers. Now, when we are talking about the superficial fat layers, we are not talking close to the dermis, but into the mid layer of the subcutaneous fat around this area, not very superficially. If this solution is injected too superficially, it can actually cause damage or necrosis or death of the skin. So, this is a dreadful side effect which you must be careful about. But if you inject it within the fat cells, then you will never get this problem or this side effect. Okay. Now, when you inject this solution, typically, the patient may feel some amount of discomfort and burning and pain. The patient will definitely have some swelling. Swelling occurs because of the anti-inflammatory effect or the phagocytosis or the destruction of fat cells that it causes. So, if you have swelling, don't worry about it. That means that the solution is effective. And once the swelling subsides, the fat is going to reduce. How much time does it take to show effect? It takes around a month to show effect. Can it be repeated? Yes, it can. You can repeat if you want more reduction after a month. So once you inject it, say for example in the double chin, you wait for a month and then you re-inject it after a month if you want more reduction. Be very careful not to go deeper than the fat cells and be very careful not to be too superficial in order to cause death of the skin or necrosis. Also, do not inject this solution around the nerves or it can cause problems with the nerve endings and the sensations. So yes, lipolytic solutions which contain deoxycholate, the popular ones are Aqualux, Geolysis, Kybella, Lipolysis, Lipolab, Dr. Lipo, LipoV and various others. So we are using them commonly in our practice and we've seen great results when you use for small areas. Who are good candidates for this? People who have localized small deposits of fat like in the double chin or around the love handles or a little bit in the arms are good candidates. Do not use for excessively large volumes or it will not cause good effects. And if patients have a lot of loose skin, then it will cause actually sagging of skin. So patients who have localized small deposits of fat, who are medically healthy and fit and who do not have loose skin, who have good elastic skin are great candidates for this kind of treatment. Typically, if you're using it around the waistline, you can expect half to 1 inch reduction in one session and you can repeat 3 to 4 sessions at a gap of 1 month each. If you're using for double chin, you may need 2 or 3 sessions in order to get your final desired effect. So if used correctly for the right patients and in the correct way and in correct hands, it will always give you promising and great results. However, there will be a category of 5 to 10% of patients who do not get too much of reduction with these treatments, they finally will have to go for nothing but liposuction. So lipolytic or mesolipolysis is a great solution for localized small fat deposits. My name is Dr. Viral Desai. To know more about lipolysis or such treatments, kindly consult us or go through our website or call us to get more information. I'm a board certified cosmetic and plastic surgeon with over 20 years of experience.